I think this is a really interesting situation to look at, and I think I can address here an issue that we don't infrequently discuss with patients after surgery. You see this lady here, you see the before, you see the after, Supercharged BBL implants, fat grafting, fantastic result, looks great, wonderful waist to hip ratio, and now we have the situation that 6 months after surgery, the fantastic looking patient says, "Doctor, I'm not sure, but I think there is a difference between my two buttock cheeks." Now there's a very, very high educational value in this case, because if you look at the before, there was a literally dramatic difference in flatness of the lower butt of the right versus the left cheek, which is a normal thing. I mean, mainly not to that degree, but I always say to patients, in my whole life, I haven't seen a symmetric buttock because in nature such a thing does not exist. Afterwards, very nice buttock projection, but of course there is a slight difference between both sides, which is less than before, but it's still there. So for our patients to be happy with their outcomes, we do always need to reinforce understanding we are modifying an existing situation, and this is within the possibilities of the tissue and within the nature of the tissue. So we're not creating something completely new, but what we do create will always have something to do with what the patient looked like before. Makes sense, you will say. Yes, but what is something that always makes me smile in a way, but I think it's important to remind patients about it. People afterwards love the results of their surgery, and they look in the mirror the whole day, and then they notice things that have been there all their life. So for your happiness, it's important to remember our bodies are not symmetric before surgery, and they won't be symmetric after surgery. It's just not the way that we are.